All right. So, hello, doctors, and welcome to our session for today. Today is the first session of the skills mastering session, which I predict that they will be very, very useful and will help everyone here in mastering the different exam skills. So please don't miss this opportunity. Please participate. Please take the comment and correct your skills while you are practicing. You will find that you can do these skills. Okay? All right. So this is our plan for today. We are going to take Breaking Bad News skill. I'm going to teach the structure of Breaking Bad News quickly. Then 5 doctors will participate to break the bad news in different cases of breaking bad news. The participation will be around 3 minutes for each doctor. After the 3 minutes, I'm going to comment on how did they perform in each skill. What did they miss and how to improve that. Okay, did they follow the structure of breaking bad news? Did they miss anything? And how to improve the skill. All right. Then after finishing the breaking bad news cases, we will have a break for 10 minutes. After that, we will take the medical error cases with 5 different doctors as well. All right. Let's dive into the skills now. And the first skill is breaking bad news. Okay. This is the structure of breaking bad news. We are not going to talk about the whole case. We will ignore the history taking part. We will ignore also part of the management part. We will focus on how to break the bad news, the skill of breaking the bad news. All right? So be focused and focus on this skill, the breaking the bad news. All right? In breaking bad news, we have some points to fulfill to appropriately break the bad news. What are they? The first one is ideas. Ask the patient or ask the relative about their ideas. If you are talking to a relative, ask the relative, how much do you know about your relative? Whatever the relative is, son or dad or mom or husband or wife, okay? How much do you know about the condition? Or did anybody tell you about the condition now? Ideas, please. Why ideas is important?
To know where to start the conversation from?
Yes, okay. So if the patient has a specific idea or an idea about the result or the situation, you can start or break the bad news from from what he is knowing exactly now. All right. Let's say that the patient has an idea that the result might be cancer. When you ask the patient, did anybody tell you about what might be the result? Or do you have any idea about the result, Mr. X or Mrs. X? And then the patient tells you, yes, doctor, they told me it could be cancer. So are you going to break the bad news in many chunks or pieces, or one piece is enough?
I think one piece will be enough.
Yes, one piece or one chunk will be enough. Okay, so ideas is very important. Okay, then you ask the patient about, is there anybody with the patient or with the relative at the moment? By asking this question, you preparing the relative or the patient that there is something bad is going to happen or something bad happened. All right? By asking this question, you are preparing your relative or the patient about that you are going to tell him or her a bad news. All right? This is the second point. Yeah. Then, after that, you try to break the bad news in chunks and pieces. Chunks and pieces, please. Don't give the bad news in one shot. All right? Pieces and chunk. And after each piece or chunk, please give a pause. Please give a pause for 1 or 2 seconds. Yeah? So you break the bad news in 2 or 3 chunks based on what you prefer or based on the situation itself. If the patient already has an idea, you break the bad news in 1 chunk, yeah, and then give a pause. If the patient doesn't have any idea, you break the bad news in 2 chunks. 2 chunks is enough. All right, and after each chunk, please pause. Please pause. What does that mean? Pause, just don't talk. Close your mouth. Close your mouth and look at the patient or the relative. Okay? Yeah. In the first chunk, usually you tell the patient, unfortunately, we don't have a very good news. Unfortunately, the news are not as we wish. Unfortunately, the results are not as we wish. So unfortunately, we don't have a very good news. Okay, this is the first chunk. The second, and then pause, please. Unfortunately, we don't have a very good news. And okay, then the second chunk. In the second chunk, you tell the patient the situation. Okay, you tell the patient what is the bad news. Okay, based on the case, let's say that we are talking with the son and his father has massive bleeding in the brain. You tell him, well, we've done a CT scan on the head and the CT scan shows massive bleeding in the brain. Okay, this is the second chunk. After that, always, always, always in breaking bad news, think about the consequence. What does that mean? Is it a hopeful case? Is there hope or not? Is it a hopeful case or a hopeless case? What is the end result? The patient will be on the palliative care or end-of-life care, so this is a hopeless case. Or there's a treatment and there's a success rate of the treatment and there's a good prognosis of the problem. Yeah, always, always think about the hope in the breaking bad news or the consequence. Is it a hopeful case or hopeless case? And after giving the patient, is it hopeful or hopeless? You can give another pause, okay, for him or her to absorb the situation, all right? And please, please, please provide the patient with very high sympathy and empathy from your tone of voice, from your facial expression, from your body language. Please, please, from your verbal words, okay? All of these should show sympathy and empathy, okay? All right? So when you tell the patient, unfortunately, we don't have a good news, don't say it like this. Well, Mr. X, unfortunately, we don't have a good news. We have done a CT scan and the CT scan showed massive bleeding in the brain of your dad. So the tone of the voice and the facial expressions are not matching the situation. Okay, so Mr. X, Is there anybody with you at the moment? Well, unfortunately, we don't have a very good news. We have done CT scan on the head of your dad, and it showed massive bleeding in the brain. Then the consequences. Well, the condition is we can say it is terminal. The bleeding is very massive in the brain, and the best thing we can do for your dad is putting him on something called palliative care. Have you heard about palliative care before? Did you see the facial expressions, the tone of voice, lower tone of voice? Okay. Don't show that you are enthusiastic or your tone of voice is higher than the patient or the relative. Okay. So this is in terms of how to break the bad news. All right. Any question? In sympathy and empathy, you can tell the patient, well, I know how it is shocking on you. Would you like me to proceed, Mr. X? Ask him if he wants to, hear more or just that's it. Would you like to proceed? Would you like me to proceed? Or would you like me to call anybody else? Do you have any concerns? All right. So this is part of your sympathy and empathy as well. Okay. Any question in breaking the bad news? Any question?
No.
Doctor, I have a question.
Yeah.
Okay, so what, like, if the patient, okay, like they start crying and like this, and the time of the exam is running out, what am I supposed to do?
Okay. If the time is running out, you will still break the bad news professionally.
Okay.
You continue with your pace. You give the patient, or you provide if you have tissue or water or anything to use in the cubicle, use it. Offer the patient tissue. You don't need to give the patient the tissue in his hand. Just offer the patient tissue to him. Okay, do you want some tissue? You want some sips of water? I know how it is shocking on you. We are here to help. Okay? Continue your professionalism. And in breaking bad news, the time is proper, 8 minutes is more than enough to do the breaking bad news. Okay? Just this is for your knowledge. The time, 8 minutes is more than enough for breaking bad news. Don't take too much history, please. Don't take too much history. This is inappropriate. Okay? Take the ask the questions which are only relative or will only help you in breaking the bad news. All right? Then start your breaking bad news. Yeah? So from my side, I'm telling you that the time will not be running out in the breaking bad news. Yeah? But if it happens, this means that you took a very long history and you will take low marks in the data gathering. Okay? Because you asked irrelevant questions, which is not relevant to the situation. Yeah? If the time is running out, continue your professionalism. Yeah?
Okay. So like there will they ask what's going to happen now, doctor, or should I just tell them, would you like to hear what we can do? I mean, what?
Yes, yes. Ask them. Would you like me to proceed, Mr. X? Would you like me to proceed? Would you like to know what is the next step? Or would you like me to call somebody to be with you? If he tells you what is the next step, what should happen, then you talk about the management.
Okay.
Okay? And you will maintain your sympathy and empathy.
Okay.
Okay? All right. Okay. So let's start our practice. Are you ready? Who is ready?
If you don't mind, doctor and dear doctors, can I start first because I have to take my child to the nursery in the next half an hour?
Yeah, of course. Who is that?
It's Riley.
Isra. Okay, Dr. Isra. Yes, of course.
Thank you.
Okay, so the timer. And before that, I'm going to give you the scenario. All right?
Yeah.
You are talking to the son of Mr. White.
Okay.
Okay? The son's name is Adam. Yeah. Tell him that you performed a CT scan of the head on his dad. All right? And the CT scan is showing rupture aneurysm in the brain.
Okay.
Okay, rupture aneurysm in the brain. The medical decision is putting the patient on a palliative care.
Okay.
Okay? No surgeries can be done to the patient.
Okay.
Do you want me to say it again?
So I'm talking to Mr. Adams, the son of Mr. White. He a CT scan has been done and ruptured beta aneurysm was found, and he would be put into palliative care.
Yeah, and no surgeries can be done.
No surgeries, yeah.
All right?
Yeah.
Okay, you have 3 minutes. If you're happy to switch your camera on, I'm more than happy
Yeah, sure.
to provide the feedback on your body language.
Okay. So I guess it's on now.
Yes, Dr. Isra.
Okay.
Okay, good. All right. So let's start, Dr. Isra.
Just a minute. I want to find my
Yeah,
myself to be able to put the camera in the right place.
I can see you.
Okay, right.
Yes, I can see you.
Perfect.
All right. Start, please.
Hello.
Yeah, hello, doctor.
Dr. Ali. I'm the treating doctor of your father. Is it Mr. Adam?
Yes, doctor.
Okay. So, what exactly do you know about your father's condition, Adam?
Oh, what I know, doctor, that he's in the hospital after having, he had a blackout. And since then, I don't know anything.
I can see. So, Adam, do you have anyone with you at the moment?
No, doctor.
Would you like to have someone with you from family or friends?
No, doctor. Please tell me what's going on. I'm okay.
Okay, I can see that you're worried. Adam, I'm sorry to say that I don't have a good news regarding your dad.
What do you mean, doctor?
So, your dad, he had a sort of bleeding inside his head. We've done a CT. Okay.
Okay.
And unfortunately, the bleeding was huge, and it was a big one.
Okay.
So, as a consequence of that, unfortunately, we can't treat it. So he would be put into some sort of treatment called palliative care.
Well, oh my God. So you can't treat it. You can't do anything for this bleeding, doctor?
Yeah, I'm really sorry to be the one to tell you this all information. But the palliative management It's a sort of management to make sure your father is relieved and that he is not in pain while we manage him.
Okay, doctor. So is there any surgery to be done to him?
Unfortunately, surgery won't benefit him a lot. So there won't be any surgery for him, but we will take good care of him in other ways.
And what is that palliative that you mentioned?
Well, it's a sort of combination of multiple aspects where we give patient painkillers, we make sure that they are breathing well, and other stuff. Would you like me to tell you about the details of the management?
Yes, doctor, please. Yes.
Okay. So regarding the palliative, we make sure that your father he's breathing, he's well fed, he's cleaned. Okay. If there's any sort of infection, we will treat it as well.
Time's up. All
Okay.
right. Thank you, Dr. Isra.
You're welcome. Oh my God. This is my
How
first
do you feel? How do you feel?
I was a little bit, there was a lot of palpitation and my hands are cold, but I feel good to some extent.
Okay. All right.
I don't know the details of the palliative management, but I know the whole idea.
Okay.
I would love if I added, I'm here for you, and then ask him if he would like to have someone with him after hearing the news.
Yeah.
Yeah, but I didn't
Okay.
add that one.
All right.
It was a good experience. Okay.
Okay. No worries. Thank you, Dr. Isra.
Thank you, Dr.
All right. So I'm going to comment now.
Okay.
Well, you asked me about the ideas. How much do I know? Which is a really good thing. Anybody with me at the moment, you're preparing me for breaking the bad news, or there's bad news which is coming. Yeah. Unfortunately, we don't have a very good news. You've mentioned that. And you gave me a pause. Okay, good. He doesn't have any idea, so you can break it in 2 chunks. Yeah. The second chunk, you were a bit disorganized in giving me the situation. Yeah. So you told me there is massive bleeding or some sort of something like this. And then you told me we have done a CT scan.
Yeah, I should have said CT first.
Yeah, you narrate the situation chronologically.
Yeah.
It will really help in understanding the situation. So, well, we've done a CT scan on the brain or the head of your dad to find out why did he have this blackout? Okay, and unfortunately, the CT scan showed massive bleeding due to rupture of a vessel in the brain. Okay, so this is what is the information you've given this information, right? You've been given this information, rupture berry aneurysm. Okay,
Yeah.
so tell him the situation. Okay, massive bleeding due to rupture of a big vessel in the brain.
Okay.
And pause. Okay, so you gave me the chunk, but you need just more organization of thoughts in in that second chunk. Okay. The consequence. It's hopeless, all right?
Yeah.
So what did you tell me? You told me
He will be put in a palliative care.
yes. You told me
It's
the patient will put on a palliative care. Okay. Then you were not able, or you didn't explain what is the palliative care in properly. All right.
Yeah.
So you tell him, well, okay, the best thing for your dad, for the condition of your dad, is putting them on something called palliative care. Okay. Have you ever heard about this before? Then you tell him, well, okay, as you mentioned, the situation cannot be treated with any treatment, okay? But in the palliative care, it's a holistic care in which we take care of the patient. We make sure that they are comfortable as much as we can. We don't put any stress on them by too much treatments. Okay, so comfortable. Don't just, you know, link palliative care to pain only.
Yeah.
Okay, so we make sure that they are comfortable as much as we can.
Mm.
Okay.
Yeah.
We don't stress. We don't put too much stress on them by many treatments, because this will make too much stress on them in this time. Okay. And did you tell me what is the consequence of this rupture? I mean, yes, you put the dad on the palliative care, but the patient doesn't know that his dad might die.
Yeah. This is the hardest part. Okay.
Okay.
Mm.
All right. So you tell him, unfortunately, the condition is very critical, and he's highly unlikely to survive that. It's very important. Okay. So you have to be clear about this. Okay. So yes, the consequences is palliative care, but you didn't tell me, well, okay, my dad is going to,
Yeah.
all right, this is a treatment. This is part of the treatment, or a type of treatment, but I don't know. Okay, my dad is okay now, so he's going to continue his life on the palliative care, or is the condition is critical and he might die. Okay, so it's very important to be clear about the consequences, please. Okay. So this is another thing that I wanted to emphasize on. Please be clear. Consequences doesn't mean that just telling him the next step of treatment. No, tell him there's hope in the case, or no, the patient will continue his life, or he will, die, or he might die. So they can arrange their arrangements to see his, to see his dad, or to ask the family to come to see him.
Yeah.
Okay.
Okay.
All right. Then your sympathy and empathy was okay. You didn't, your facial expression and your tone of voice were okay. So you fulfilled ideas. Anybody with you at the moment? The first chunk was very, very good. So my concern is the second chunk, organization of the ideas, and being clear about the consequences. Okay. Sympathy and empathy is okay. All right.
Thank you, doctor.
Thank you, Dr. Isra. All right. Let's do the next one.
My name is Ali.
Aline?
Yes, Ali.
Ali, Dr. Ali. Okay. So yes, Dr. Ali, we can do the case with you. Are you happy to switch your camera on, or you don't want?
Yes, if you wouldn't mind giving me 10 seconds.
Yeah, of course.
Can you see me now, doctor?
Yes, Dr. Ali. Yeah, okay. All
Yes,
right.
we've met before.
Yeah,
Nice to see you.
okay. Yeah, nice. Thank you. So, you are talking to the son of Mr. White. His name is Adam. Okay, the son's name is Adam. Tell him that you performed the CT scan on the head of his dad. Okay, this CT scan shows rupture, berry aneurysm. Okay, let's say massive bleeding. Shows massive bleeding in the right hemisphere of the brain, okay? Massive bleeding in the right hemisphere of the brain. The medical decision is putting the patient on palliative care. No surgeries can be done. Okay?
Mhm.
All right?
Okay.
Okay. You have 3 minutes and then, yeah, start.
Hello, Thomas. I'm one of the physicians attending to your father.
Hello, doctor.
I've been understanding that you wanted to see me.
Yes, doctor, they told me you're going to tell me about the condition of my dad.
And can you tell me so far what had happened with your dad?
Well, he had a blackout all of the sudden, and then I brought him to the hospital. And since then, I don't know anything about him.
I see. And Thomas, is there anybody that is with you at the moment?
Well, nobody's with me at the moment, but I'm okay. You can tell me what's going on. Is he okay, doctor?
Would you like us to move to a quiet room?
Uh, well, it's okay. Yes, yes, doctor.
Okay, please have a seat.
Yeah.
So it's unfortunately I have to tell you that after your father had his blackout,
Okay.
we had a CT, an imaging of their head,
Okay.
and what we found out was that he had a ruptured berry aneurysm. Are you familiar with that?
No, doctor. So what's that?
Well, it means that a vessel in his brain has opened and he's suffering, unfortunately, a massive bleed right now.
Oh my God. Well, is he okay,
Really,
doctor?
sorry, go on.
Is he okay? Will he die?
At the moment, we are doing the best that we can to stabilize them. But the prospects of survival of such a condition, I'm sorry to tell you, are very slim.
Do you mean that he's going to die, doctor?
We have made the decision to transfer him to a form of care called palliative care. That means we will no longer try to prolong or extend his survival. I cannot give you an exact timing or a certainty of the event, but would you like to know what can we offer them so far?
So are you going to leave him like this?
No, absolutely not. What we're going to do is that we're going to prescribe them medication to relieve their anxiety, relieve their problems, so that they can um, reach their imminent and unfortunate departure, but with comfort, without pain, and without any agony. Would you like a tissue, Thomas?
No, thank you, doctor. Thank you. Okay. Time is up, Dr. Ali. Thank you. Thank you for your participation. So how do you feel?
Um, you're welcome, and I feel that I might have been slower than expected. Like I could have been a bit faster so that I can, get in more to say.
No,
Um,
no, your pace was very good. I'm happy
hmm
with your pace in this case. Okay? You
hmm
should be talking in this pace. Okay?
hmm
Faster pace and breaking bad news is not good.
Okay.
Okay? So you've done almost all of the points of breaking bad news. Okay. So you've asked me about how much do I know? All right. Anybody with me at the moment? You've broke the bad news in one chunk, not two chunks, okay? Which is okay. It's not, mandatory to break the bad news in two or three or one chunk based on what you prefer, okay? It is advisable if the patient doesn't have idea, you just tell him that there is a bad news or the news are not very good from as a first chunk, and then you explain, but you've explained it in a very good way, okay, in one chunk, which is good, okay. You gave me a pause. Your pace in talking was very, very appropriate to the situation. Okay, you have to have this pace in talking with the relative. This is a bad news, and the relative should absorb everything. Okay. You gave me pauses. Okay. Then you told me the consequences, that there is, high chance of no survival of this problem. Okay. And you told me about the palliative care. So you will have a very high level of English, which is really a good thing.
But it helps.
But sometimes I'm not sure if if these high level words of English will be, I think it's good because many of the patients knows agony, and I think it's suitable. Okay. So yes, you've told me the consequences, which is a really good thing, and you explain the palliative care. But please, doctors, try not to link palliative care to only pain. There are many things in the palliative care other than pain. So it's a holistic care, okay? And we make sure that the patient are comfortable as much as we can, not only pain. So many things to be done. But yeah, you've done it really well, Dr. Ali, in terms of the tone of voice, the facial expression, and the body language, the tone, the pace while you're talking, everything was okay. Good.
Thank you, Dr. Shah. And if I could ask one question very quickly, what would be a better answer to the question of, is he going to die? I felt that I would have liked to answer that better. I feel that it's a difficult question. I'm not sure. What do you think?
What you said? What did you say now?
I'm not sure. It's a
No,
difficult question.
it's difficult. So tell him, well, okay. It's a question which is really difficult to answer. Okay. We are doing our best. From his condition, the condition is critical. Okay. And the survival rate is very low, but we are doing our best. Okay.
Mhm.
Yeah. So you don't know if he's going to die now in this admission, or he's going to die in 2 days, or after 1 month maybe. So it's based on the massiveness of the bleeding and the condition itself. So it's a question which is difficult to answer, but the condition is critical. You have to be clear about this. The condition is critical and the survival rate is very low.
Mhm.
All right?
Yeah.
Okay. Yes, good. Very good, Dr. Ali.
Thank you, Dr. Shah. Nice to see you as always.
Thank you. Thank you so much. All right. Let's do the next case, doctors. Who is ready?
Okay, doctor, I can go for it.
Who's talking?
Marina.
Okay, Dr. Marina. All right. Are you happy to switch your camera on?
Yes, doctor.
Okay, good.
Can
So
you
I'm
see
going.
me? I don't know.
Yes, I can see you.
Right,
Yes.
okay.
Okay. So you have a patient
Mm-hmm.
you are talking to Mrs. Sarah White.
All
Okay,
right.
Sarah White. You are explaining to her her test results. The test
Mhm.
results showing ductal carcinoma in situ.
Okay.
All right. So
Mhm.
explain to her the results and manage the situation.
All right. Okay.
We all know that ductal carcinoma in situ is what?
It's a malignant condition, so
It's cancer,
Yeah.
carcinoma, okay?
Yeah.
So
Yeah.
it's cancer. All right.
Okay. All right. Okay.
Just let me clear this. Okay. Yeah. So you have 3 minutes starting from now.
Okay. Hello.
Hello, doctor.
My name is Marina. I am one of the junior doctors here. Are you Sarah White?
Yes, doctor.
Okay, good to see you, Sarah. So I understand that you are here today to discuss your test results. Am I right?
Well, okay, don't start by introducing yourself or anything. Just
Mm.
start from the part of
All
breaking
right.
the bad news, okay? Just to save your time. Yeah,
All right. Okay.
start again.
Okay. Hello, Sarah. So I understand that we are here to discuss your test results.
Yes.
Can you tell me if you have any idea what could be going on with you?
Well, they told me that one of the causes of the lump that I have is cancer. Is it
Okay.
cancer, doctor? Please tell me, is it cancer?
Well, okay, Sarah, I'm going to discuss everything with you, but before that, would you like anybody to attend the session with you?
No, doctor, I don't want anybody to be with me. I'm happy, I'm okay. Just tell me, is it cancer, doctor?
Well, Sarah, so as we understand, we took the biopsy from you and we do some analysis. And I'm so sorry to say that, but I don't have a good news for you today. And I'm so sorry to say that, but the results showed that you have cancer of your breast. I'm so sorry, Sarah, to bring this bad news for you. Would you like some tissues?
It's fine, doctor.
I'm so sorry.
So, what are you going to do?
Well, Sarah, so the type of this cancer is called carcinoma in situ, which means like it's a very early stage of cancer. So we do have a lot of things that we can do for you now. Would you like me to discuss that with you now?
Yes, yes.
Okay. So what we need to do now, we will refer you to the surgery team. Okay. So they will discuss with you everything what they can. I mean, sorry, we will refer you to the cancer team. They will discuss everything with you. There are a lot of options available, which might be surgery. They will do a surgery to remove this part of the cancer, or it might consider giving you chemotherapy or radiotherapy. Are you happy with that?
Okay. As long as that I'm not going to have a surgery, I'm happy.
Well, they will discuss everything with you about the options of treatment. Either it will be surgery, chemotherapy, or radiotherapy.
I don't want to have any surgery, doctor.
Is there any cause for that?
I don't want any disfigurement for my breast.
Well, I see that. I totally understand that. But there are a lot of different options of surgeries available. So it will not, I mean, the removal will not be to the whole breast. There are a lot of options, maybe conservative for the breast. So they will discuss everything with you. And as
Okay.
I just mentioned, time's up.
Time's up. All right. Okay. Thank you, Dr. Marina. All right.
Thank
So
you.
how do you feel?
Very nervous, to be honest. It's the first time to discuss in front of these
Good.
people.
Yeah,
So
that's good. That's good. Yeah, I'm happy with this. All right. Did you do any Breaking Bad news before?
yeah, I did
Okay.
it before.
All right. How many times?
I can't remember, but maybe 2 to 3 times. So,
Okay. All right. Good.
yeah.
Okay. And you were doing it like this, or you are following the structure?
No, I think I did it previously in a better way than that. Yeah. So
Okay.
yeah.
All right. Yeah. Okay. So, well, okay. So I'm happy with your performance. It's a good you know attempt. Very good.
Thank you.
But before I forget, this is a comment for you and for Dr. Ali as well. I didn't comment on that.
Mm-hmm.
Do not offer the patient tissues or anything if it's not in the cubicle.
Yeah. Okay.
All right. So don't
Mhm.
assume that there is tissue or there's water or anything. Just if you don't have anything, just move on. Okay. Don't
Mhm.
offer the patient anything. All right. You asked me about the ideas. I do
Yeah.
have an idea before. All right.
Mhm.
So, you could tell me, unfortunately, we don't have a very good news, and then, as you mentioned, it's fine. Okay. You could also tell me, well, okay, unfortunately, the results are showing type of cancer, as they told you before.
Mhm.
Okay. Always in breaking bad news, short pieces of information with, you know, just 1 or 2 sentences is better than telling
Yeah.
them too much information. Okay, because you told me, unfortunately, the news are not good. We've done the results are showing type of cancer of your breast. Okay, so you were talking a lot before telling.
Mhm.
So just focus on talking in a slower pace. Okay,
Okay.
all
Yeah.
right, slower pace.
Mhm.
So this is my comment. While you are practicing, look after or try to master talking in a lower pace or slower pace. Yeah,
Right. Okay.
okay. Then you give me a small pause, a very small pause. Yeah,
Yeah.
pause. Count 1, 2, 3, 4. Count. Okay, and then tell sorry if you want to say sorry. Okay.
Okay.
So yeah, you told me anybody with you at the moment. If I'm on a phone call, what would you say?
Do you have anybody with you at home at the moment or something?
Okay.
Yeah.
Do you want to come
To come or
and
okay. Yeah.
discuss the results with us here?
Yeah. Yeah. Yeah.
Okay.
Okay.
Something else with to Dr. Ali, because you assumed that we are in a noisy place. So Dr. Ali, you are already in the cubicle, so avoid assuming that we are in something, not in the cubicle. Just tell him, all right, is there anybody with you at the moment? And then start, okay? Because you're already in a quiet room. All right. Yeah. The consequences.
Mm.
Is it hopeful case or hopeless case?
I think it's hopeful case.
It's
Yeah.
hopeful case.
Yeah.
All right.
Mhm.
So say it, more obvious than this.
Okay. Yeah.
Okay. So you tell him, all right, Mrs. X, despite that it is cancer, but there is a lot of hope here. All
Mhm.
right. Give her hope.
Yeah. Yeah. Okay.
There is a lot of hope here, all right? This type of cancer has a very high success rate of treatment, okay?
Mhm.
And it is in the very early stage, if it's written in
Okay.
the question, very early stage, all right?
Mhm.
So please have some hope, okay?
Okay. All
All
right.
right?
Okay.
Then,
Mhm.
so be clear here,
Okay.
okay?
Yeah.
Yeah.
Mhm.
You gave me some sort of sympathy and empathy. I would love if you just your tone of voice should, just be, a lower tone of voice, or I'm not sure. Maybe you usually have enthusiastic way in talking, maybe
Okay.
because of this. So just try to, act that this is a bad
Yeah.
news. All
Yeah.
right.
Okay.
Yeah. What else? What is the treatment?
I was a bit hesitant with the treatment. I said in the beginning we will refer you to the surgery team. Then I went to the
Yes,
cancer
they
team.
the breast surgeons, the
Yeah.
surgery team,
Yeah. Yeah.
the surgery team or the breast clinic. You
Yeah.
will send her again to the breast clinic. They will
Okay.
discuss with her the options of treatment, either surgery or chemo or radio. When I told you, as long as it is not surgery,
Yeah.
then you tell me, well, okay, I can see that you don't want surgery from your
Mhm.
words. Is there any
Yeah.
specific reason behind this? Yeah,
Yeah.
because when I told you, as long as it is not surgery, I'm happy. Okay.
Yeah.
Then you told me, well, they will discuss with you surgery or chemo or radio. So
Yeah.
pick up the clue. She told you a clue. She doesn't want surgery. So go with the refusal structure.
All right. Okay.
Okay. All right.
Mhm.
But well done, Dr.
Thank
Mariana,
you.
Marina, right?
Marina.
Yeah, good. So keep it
Thank
up.
you, Doctor.
Thank
Thank
you.
you.
Thank you.
Thank you so much.
Thank you. Let's do the next one. Yes, Dr. Majid, happy to do the case?
Yes,
Yeah.
doctor, thank you. Hello.
Okay, good. Thank you. So the same case, you're talking to Sarah White, and you are explaining to her the test results, okay? And the test results showing early stage of ductal carcinoma inside. Okay?
Okay.
All right.
Yeah.
You have 3 minutes. Just give me a second. Yeah. Starting from now.
Okay, Sarah, what do you know about your test result? Do you have any idea about that?
I don't know anything, doctor. They didn't tell me anything. So what's going on?
Okay. Okay. Is there anybody that can be with you at the moment?
No, doctor. No.
Would you like me to call in somebody to be with you?
No, it's fine. Tell me what's going on.
Okay, Sarah, I have your test result, and unfortunately, I don't have any good news for you today.
What do you mean by not good news?
I mean, your test result seems to be more serious than we thought, and that shows you had breast cancer.
Oh my God. Do I have breast cancer?
Unfortunately, yes, but I rest assured we do our best to treat your condition.
Okay, so what are you going to do?
Okay, Sarah, we will refer you to cancer pathway within 2 weeks,
Okay.
and within 2 weeks, and they assess you and do further tests. And we have they have options to treat you. And I want to say there is this type of cancer had high success rate to treatment.
Okay.
That's it.
All right.
Do you have
Okay.
any
So,
concern?
yes. What are they going to do there?
They do some other tests and know the stage of your condition, and based on your stage of condition, they do maybe some surgeries or some other treatments like chemoradiotherapy. Am I making sense?
Yes, doctor. Yeah.
Okay. Is there anything that you want to like me to do for you at the moment?
No, thank you, doctor. Time's up. All right. Thank you, Dr. Majid. All right. So how do you feel?
So it's my first time and very nervous, but I think besides of and some hesitation to speak, but I do that do fairly.
Okay. All right. Good. That's good that this is the first time, which is really, really good. Okay. You tried to follow the structure. And yes, for the first time, it's really nice, really good. Okay. All right. So yeah, let me comment on your performance. Yeah. Before I talk about what you followed in the structure, I would like to comment on your not facial expression, your eye contact. Okay. It's extremely important to talk with the patient in their eyes. Eye contact. You were trying to move your eyes here and there and there and there. Okay. And yes, I know that you are trying to gather your ideas. Okay. Because this is the first time. So I do appreciate that. But in the exam and in your practice, try to practice on this, because I picked this up. Maybe you are practicing without switching your camera on, right? With the partners. Yeah.
Yes, it's the first time.
So I highly advise you from now till your exam, because this will be a problem in the exam if you just, I highly advise always to imitate or to simulate the exam condition. In the exam, you're not going to talk with a patient over the phone in all of the stations. In most of the stations, you are going to talk with a patient face to face. All right. So it's always important to practice on have a good eye contact between you and the patient, and especially in breaking bad news. Okay.
Yeah.
Yeah.
Okay,
All right. So my advice to you, please, from now till your exam, ask your partner to switch, the camera and practice together, face to face, on the computer, just to find out, do you have this good eye contact or still, thinking? Yeah.
Okay. Yeah.
Please. This is the first thing. Secondly, you asked me about my ideas, which is good. Anybody to be with me at the moment, really good. Unfortunately, we don't have a good news and pause. Good. You told me I do have a type of cancer or cancer in the breast with pause, and the consequence, you told me it's you were a bit hesitant in this point. Okay. You told me there's treatment and there's high success rate, I think, and then that's it. You told me that's it. Yeah?
Yeah, I tried to say that there is a high success rate in treatment, but in a wrong way.
Yeah, okay, it's fine. All right, so try to tell her, okay, please, Mrs. X, don't worry. There is a very big hope here. This condition is in a very early stage. It has a very high success rate with the treatment. There are many treatment options. So give her hope. Okay. I do appreciate that this is the first time to do so. I'm not expecting that you are going to talk a lot in the consequence, but good. Yeah. In sympathy and empathy, your pace is okay. Okay, your pace in talking was okay. Your facial expression was okay as well, matching the situation. But the only thing is your eye contact and searching for the ideas. Okay, so you followed the structure, all right, but the facial expression would affect your marks. Okay, so please try to focus on this bit in your practice. Yeah.
Okay.
Okay, good. Good, very good attempt, Dr. Majid. Very, very good attempt.
Thank you for
Yeah.
this opportunity.
Thank you. Thank you. Yeah, good. All right, let's do the next one.
Okay, doctor.
Dr. Mina, right?
Yeah.
Good. Happy to switch your camera?
Yeah, sure.
Okay. All right.
Okay.
So let me clear that. Yeah. You have 3 minutes. Okay.
Okay.
The case is you are talking to Mr. Joshua White. Okay.
Okay.
You explain to him that his son, Adam, had CT scan hit, and the CT scan is showing extradural hemorrhage.
Okay.
Okay. They must do a surgery to evacuate this blood.
Okay.
All right.
So it's Mr. Joshua White.
Yes.
And his son is Adam, or
Yes, Adam.
okay.
Okay. Adam has
Adam
extradural hemorrhage. He had CT
Yeah.
scan on his head. The CT scan showed extradural hemorrhage, and the surgery should be done to evacuate this bleeding, this blood. Yeah.
Yeah.
All right. Okay. 3 minutes. Start.
Okay. Hello, Joshua. So I am Dr. Mina. I'm one of the doctors here today. I am one of the responsible doctors for the care of your son, Adam. Okay.
Yes, doctor. Yeah.
So Joshua, could you tell me what do you know so far about the condition of your son?
Well, he had an accident, doctor, and
Yeah.
they didn't tell me anything. Until now, I don't know anything about my son. Please tell me, is he okay, doctor? Is he okay? Please tell me.
Okay, Joshua. So as you know, after your son was admitted to the hospital, we performed a CT scan of his head. Okay.
Yes.
Unfortunately, Joshua, the CT scan shows that your son Adam has what's called an extradural hematoma.
Oh, what is that, doctor?
Well, it's a bleeding in his around his brain, behind his skull.
Oh my God, my son. My son, it was my fault. It was my fault.
I am so sorry, Joshua, that I have to bring to you this terrible news. I'm so sorry about that. I can only imagine that they are a huge shock to you.
Is he going to die, doctor?
Well, in terms of the prospects of his care, Joshua, actually he was reviewed by the neurosurgeon, and he decided that he will go into a surgery to evacuate this hematoma. So
Surgery. Okay,
yeah,
surgery on his brain. Oh my God. Is he going to survive, doctor?
well, I can't tell you specifically, Joshua, if he is gonna survive or not, but I can tell you that we will do the best we can. And actually, a lot of patients survive extradural hematoma by evacuating through surgery. So right now, we are optimistic that the surgery will make his condition much better.
Okay. Okay, doctor. Is there any complication from the surgery?
Yes. Unfortunately, Joshua, it's a brain surgery. There could be some complication. There could be an infection of the site of the opening of his skull. There could be other complications related to the opening of his skull and the exploration through his brain. But I can assure you that right now, this is the best course of treatment that we can offer him.
All right. Time is up. Thank you, Dr. Mina. Thank you.
Okay.
How do you feel?
Well, actually, it's my first time ever to practice any case, so I'm not sure
Well,
I can
good.
even evaluate myself.
Good. Very good attempt. Very good attempt. Okay. So, I'm happy with your calmness. Okay, you are calm, which is a really good thing. Yeah. Your facial expression and your tone of voice was very good as well. Okay. You asked me about how much do I know. You missed this one. Yeah.
I'm not sure. I asked first how much do you know about the condition, and you told me that your son had an accident.
Yeah.
Yeah.
You didn't tell me, is there anybody with you at the moment, right, doctors?
Yeah, that's right. Yeah.
I think, yeah. So you didn't tell me that. Well, okay,
Yeah.
if you don't tell me, this doesn't mean that you're going to pay the station.
Yeah.
Okay? Just to emphasize, doctors, this doesn't mean that anyone who didn't tell me this, his performance is very bad. No, it's just about, few points. If you just fulfill them, the Breaking Bad News will be very, very appropriate. Okay?
Yeah.
So you missed that one. Okay. You gave me the bad news in one chunk, right?
Yeah, I
In
think.
one chunk. Yeah.
Yeah.
Okay. So you could have tell me, okay, well, unfortunately we don't have very good news about the results of the results of the CT of your son, and give a pause. Okay.
Yeah.
And then you tell me the CT scan result. It's one of the ways, but your ways was good. Okay. I can't tell that this wasn't appropriate. No, it was appropriate. Okay. I would love if you tell me from the start that there is, instead of telling me extradural hematoma, okay, you tell me there's a collection of blood between the skull and the outer covering of the brain. Okay.
Yeah.
So it's better than telling them extradural hematoma.
It just came out from my mouth.
Okay, it's fine. I would love if you tell me that, but in the next time, just try to
Yeah.
but you dealt with it in a good way. Yeah. You give me a pause, which was really good. Then you told me the consequence. there is a hope. Okay, it's a
Yeah.
hopeful case. A lot of patients survive, or the recovery from the surgery is a very high. Okay, but my comment is about your answers about my questions.
Yeah.
When I told you, will he die? Well, yes, you can't tell, but I think it's better to tell the dad. Well, Mr. X, I do appreciate that you are very worried about your son or about Adam. Appreciate the feeling or appreciate the question, and then tell him, well, it's a question which is really difficult to answer right now. Okay, we are, as you told me, we are doing our best, right?
Yeah.
But it's not good to tell him, well, I can't tell you, is he going to die or not? Tell him it's a question which is difficult to answer. We are doing our best. Okay, this is the
Yeah.
first question. The second one, I told you, are there any complication from the surgery? You told me yes. You are you are making him more worried. Okay,
Yeah.
so you tell him, well, okay, let's agree that like any surgery, there are multiple complications. Okay.
Yeah.
I can tell you what are the complications in a bit, okay? But let's agree that the risks or the benefits outweigh the risks in the situation of your son. So we are doing the surgery to save his life. Okay? So
Yeah.
this is how to ask or to answer the questions of, the complication. You are going to tell him the complications. There are infection. If he wants to, tell him I'm going to explain to you shortly if you want to know the details of the complications. But let's agree on that the benefits outweighs the risks in the condition of your son. We are doing the surgery to help your son.
Yeah. What I said, doctor, I think I said that there's the surgery, the best that we can offer him right now in terms of.
You told that, but before
Yeah.
it, you told me, yes, there are complications like infection, like blah, blah. So you are, you are making that, okay, no, I'm not going to do the surgery. Yeah?
Yeah.
Okay, so the way to answer the questions should be, appropriate to the situation. You are trying to convince the father for doing the surgery, right? Not convincing, but telling him that this is the best thing that we can do to your son. Okay, so it's not appropriate to tell him, yes, there are many complications, like blah, 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 blah. Yeah?
Yeah.
Got me? Got
Yeah.
my idea?
Yeah.
All right. Okay, but well done, Dr. Mina. You've done it in a very good manner. Yeah, good. Okay, Dr. Roa?
Yes, doctor.
Okay. So you are going to deal with the same dad. Okay?
Okay. I'll open my camera. Oh, sorry.
Yeah.
Okay.
All right. So you have 3 minutes.
Okay, he's Joshua.
Joshua, you're talking with Joshua. His son is Adam. Adam had CT scan. The CT scan is showing extradural hemorrhage. They must do a surgery to evacuate the blood.
Okay.
Okay. Start.
Well, hello, Joshua. Do you have any idea what could be going on with Adam at the moment?
No, doctor, they didn't tell me anything since he was since I brought him to the hospital. No one tell me anything. Please, doctor, tell me, is he okay?
Well, I will tell you everything, but I just need to ask you, is there anybody with you at the moment?
No, doctor, no one is with me, but tell me what's going on, please.
Actually, we did a CT scan, which is an imaging technique on Adam's brain, and we found a bit of a bleed.
On his head, in his head.
Yes, the bleed is between his brain and the skull. It's not in the brain, it's between it and the bone.
Okay. All
Okay,
right.
so of course, this blood shouldn't be there. So to try to remove it, we will have to do a surgery.
Oh my God. Surgery. On the brain.
Not on the brain. It's to try just to get the blood from the area between the brain and the bone. We'll try not to go in the brain itself. We'll try it will be mostly in the space between both of them, but it is still a risky procedure.
Oh my God. Is he going to die, doctor?
Well, from where we are standing right now, we cannot say if he is going to die or if he is going to pass it, but doing the surgery is the first step to help save his life.
Is there any complication from this surgery, doctor?
Well, generally speaking, any surgery has its complications, but when we get it down into Adam's case, we can easily say that the benefits outweigh the risks by far more. So if you're still happy to know the complications of the surgery, I can tell you them, but not having it is going to be much worse.
Oh my God.
So would you like to hear about those complications?
It's fine, doctor. It was my fault. It was my fault.
Josh, accidents happen. This is not the time for us to blame it on anybody. Right now, we just have to focus on Adam and give him the best care we can so we can help save him. We will just do the surgery if you accept, and we will try to drain that blood outside, and then we will assess him and see where we can take it from there.
Okay, time's up.
Would that be
Thank
okay?
you, Dr. Ron.
Okay.
Thank you. Thank you.
Yeah.
How do you feel?
My heart was racing. It's my first time for anything, so.
Okay. Did you do Breaking Bad News before?
In real life, maybe in Egypt, but with PLAB, I've never done anything.
All right. Okay. Well, okay. So you follow the structure, okay, in a very good way, okay, in terms of asking about ideas, anybody with me at the moment. You gave it in one chunk, which is good, not very bad. You told me about the consequences doing a surgery.
Doctor, I have just one question about the chunks. In this case, I took that telling him that he has a bleed is a chunk and that he needs a surgery is the other chunk, or is there another way that we need to divide it?
Well, you can tell that doing the surgery is the consequence of
Okay.
the
Of the bad news.
problem, okay, doing the surgery and giving hope, okay, because it's a hopeful case, right? There's some hope in this case, right? So
Yes.
many patients can recover fully from the extradural hemorrhage. Okay, so this is the consequence. You give me, you narrate the problem in one chunk and then give me a pause, which is good. Okay, if I were you, I'm going to give it in two chunks. Unfortunately, I don't have a very good news about the results of the CT scan of your son, and give pause, and then the CT scan showed bleeding between the outer covering of the brain and the skull. Okay. So it's based on what do you prefer. This is not mandatory. It's a kind of ideas or points to follow just to give appropriate breaking bad news. But if you use your way, it's not a very bad thing. Yeah. Okay. So you followed it, but my concern is your tone of voice and your facial expressions.
Mm.
Okay.
I'm a mask face.
Okay. So if you you know, if we, you know, if I talk as you did, you told me, well, in every question you tell, well, okay, your way in dealing with the situation is showing that you are talking about something which is normal, or you are talking with a doctor, and this is
No.
not appropriate to the situation. Okay, this is a dad. His dad, the dad has a son. His son, who, you know, his son, my son, had an accident, and there's bleeding in the brain. Whatever the bleeding is, a small bleeding or large bleeding or anything, just, you know, a small trauma to my son, I will be very, very nervous, and I need support. Okay. So if I don't see this support from the doctor, I'm not going to talk with the doctor again. Okay.
Mhm.
So the way you talked with me was showing that you are talking with another doctor, okay? Or you are explaining facts instead of sympathizing and empathizing with me.
Okay.
Got me? All right. Even when I
Yes.
told you, is it bleeding in the brain? You told me, well, it's not inside the brain, it's between the skull and, you know, the
Yes.
way you are dealing, you know, talking with me was, you know, no, needs more sympathy and empathy. Okay. So I highly advise you, Dr. Roa, Roas, right? Roa.
Roa, yes.
Roa.
Yes.
So try to practice with yourself in the mirror, okay?
Mhm.
On your facial expressions, okay? Let's say that I'm talking in the mirror right now. Well, I'm talking, okay? And I'm just feeling the situation. I'm feeling the situation. The problem is a big problem. I'm talking with a dad or mom who has his son or her son having an accident. They are anxious. The situation is very bad. So I need to talk in a very good pace. I need to show sympathy and empathy with my facial expression. And I, you know, need to show this frankly. Okay. So, is there anybody with you at the moment, Mrs. X? Can you see the face, you know, the eyebrows and, you know, the, okay. Unfortunately, the news are not as we wish. Even if you are going to fake it, fake it.
I'll
Fake it.
try.
All right? Fake it, please. Okay? So it's very important, Dr. Roa. It's very
Okay.
important. If you do the steps, you've done all of the steps. Wallah, you've done all of the steps. But with the facial expression and the tone of voice, I don't think that they are going to give you high marks in the interpersonal skills.
Okay.
All right?
Okay.
Okay? Please don't, I'm not offending you at all.
No, no, no.
I'm not criticizing you at all. I'm just telling you what you missed and what should be
No, thank
done.
you for your comments. Thank you for the
Thank you.
comments. Thank you.
When I started dealing with breaking bad news, I was horrible. I was horrible, okay? So it's about practicing, okay? It's about practicing on playing with my facial expression, with my tone of voice, and with the poses and chunks and pieces, how to show my sympathy and empathy, okay? So,
Okay.
the words that you've said are correct. The structure is correct, okay? But the way.
I'll try
needs.
to work on that. Thank you.
All right. Yeah.
Thank you.
Thank you, Dr. Ron. Thank you. All right. So we have done the breaking bad news cases. I will give you 10 minutes break, doctors. Okay. And then we are going to come back to the medical errors. Yeah. So let's move on to the medical error quickly. Well, I count medical error is the same structure of breaking bad news. Why? Is telling the patient that there is a medical error happened in the treatment or the result. Is it a good news or is it a usual news?
No. No, it's unusual.
No. Yeah, it's a bad news. So we deal with medical error the same as breaking bad news. All right. So if I talk about the just give me a second. Yeah. About the structure, you ask the patient about his ideas, about his condition, if you're talking with a patient, or usually you're talking with a patient or a parent, okay? When you talk to the parent, you ask them how much you know about the condition of your son, or do you have any idea? Did anybody tell you about the condition of your son or daughter? All right. Then you give the medical error in pieces and chunks, like breaking bad news. Okay, in two pieces. The first piece is telling that there is a mistake happened in your treatment, or a mistake happened regarding your results, or a mistake happened in the X-ray, whatever the error that happened at some point in the care of the patient. All right. So unfortunately, there is a mistake happened in your treatment. Unfortunately, there is a mistake or an error happened in the X-rays or regarding the results, and give a pause. Okay. And then narrate. Tell them what happened exactly. Okay. And give another pause, please. Then a big effective sorry. Avoid saying too much sorry, 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 sorry. No. One effective sorry is appropriate. Okay. I'm really sorry for what happened. It shouldn't have happened from the start, or I have to admit that this is a big mistake. Please accept my apologies on behalf of my team. All right, a big effective sorry. All right, and then tell the consequence, the short and the long-term consequences. What does that mean? Once a medical error happened, what should you do in the hospital? What the hospitals do exactly?
Incident report.
Yeah. What
Yeah.
else? After the incident reporting?
They usually have a meeting to discuss what happened.
Escalation, right? Escalation. Yeah. So if we can just put the short-term consequences in two sentences, reporting and escalation. Okay? Reporting and escalation. If you want to say incident form and then we have a meeting, it's fine. All right? But the most effective way to tell the patient about the short-term consequences to gain their trust, why you need to talk about this, about the escalation and incident form and these points, to gain the patient's trust. Okay? So you tell him or her, once this happened, we report that in a form called an incident form. The hospital takes that seriously. We escalate that. We arrange meetings, okay, or a meeting to find out why did that happen and how to prevent that from happening again. All right? So the aim of the meeting to investigate why did that happen and how to prevent that from happening again. All right, they put some strategies to prevent that from happening again. And the strategies are the long-term consequences. It's based on the case, to be honest. Let's say that the medical error is missed myocardial infarction. They didn't pick the ECG up. They didn't pick that there is a T wave inversion or wave changes of myocardial infarction in the ECG. They discharged the patient as if he has musculoskeletal pain. All right? So what can be the strategies as a long-term consequences? We can arrange some workshops for the junior doctors on reading ECG, how to read ECG and avoid missing, important diagnoses like this, all right? So it's based on the case. If they didn't pick up a fracture in the X-ray, workshops for the doctors to read the X-rays, okay? So you tell him we will take that as a learning point, yeah, and we will arrange in the future some workshops to the junior doctors on how to read ECG, on how to read X-ray, based on the case, okay? So this is the short and long-term consequences. Yeah? So any ideas about what might be the result, or how much do you know about the condition? Unfortunately, there is a mistake happened in terms of your treatment, and pause, and then explain the situation, narrate what happened exactly, and give another pause. Then a big sorry. I'm really sorry for what happened. It shouldn't have happened from the start. Or I have to admit this is a very big mistake. Please accept our apology. Or as a shock on you, it is a shock on us as well. It's a very big mistake. Please accept our apologies. Yeah. Once this happened, we report that in a form called an incident form. We escalate that. The hospital takes that seriously. They arrange meetings to find out why did that happen and how to prevent that from happening again. We will take that as a learning point. We might arrange in the future some workshops or whatever the strategies that comes in your mind based on the case. All right? Any question, doctors? Any question? All right. Okay. So let's practice. Okay. So you are talking to Adam.
Okay.
He is the father of Alex. Alex has 8 years old. Came after a fall on his ankle. They've done an X-ray on the ankle. They told the father that the X-ray is normal. It's only soft tissue injury, and discharged Alex. Okay. The consultant reviewed the X-ray, and he picked up the presence of a piece of glass in the X-ray.
Okay.
All right.
Okay.
Talk to Adam. Explain the situation.
Okay. Just a question. Alex is 80 or 8 years old?
8
8. Oh,
years.
okay, so it's a child. All right. Okay.
Yeah.
All right.
Okay. So you have 3 minutes starting from now.
Okay. Hello.
Hi.
You are Adam, is that correct?
Yes, doctor.
I'm Maya Ali, one of the doctors here, and I was attending to your son, Alex. Is that
Yeah.
correct? Your son is Alex. Okay. So, could you tell me, Adams, what do you know so far about your son's condition?
Well, I came before. He had a fall on
Okay.
the beach, and then they've done an X-ray, and they told me the X-ray is normal. It's just about spraining his ankle, and that's it. So why are you calling me again, doctor? What was the problem?
Okay, Adam. So the reason I told you to come in today is because something went wrong with regarding to Alex's treatment and management.
What do you mean by went wrong?
Okay, so in the X-ray, the consultant has reviewed it, and the consultant found a piece of glass in Alex has entered Alex's foot.
Piece of glass.
Yeah,
And why they didn't tell me about this before?
because a mistake has happened while we were reviewing the X-ray.
Okay.
Sorry. I'm so sorry for this.
So is this a usual thing to happen in the hospital that you miss things?
No, I mean normally this does not happen. It's just this was just an exception. We are so sorry. Please accept please accept my apology on behalf of my team.
Okay. So what should be done now?
Okay, so please, I will need you to bring in Alex again right away. Okay.
Okay.
So, we can refer Alex to a pediatric doctor, the children's doctor. Okay. And
Okay.
we may also refer Alex to the pediatric surgeon so he can take a look at his foot and decide whether surgery is needed or not in order to remove this shard of glass. Okay.
I can't believe that.
I'm so sorry. I understand, Adam. You're in shock.
Time is up. All right. Thank you, Dr. May. How do you feel?
I think it was okay.
All right. Did you tell him a big sorry? Or an effective sorry?
I mean, I'm going with the flow.
Okay, you went with the flow, but well, from the situation, I felt that you are telling me a fact instead of telling me sorry. All right, you told me it's just a mistake happened with. It's only once. We are sorry. It doesn't work like this. Yeah. So you tell him, well, okay. Once I tell you, is it a usual thing? Once I tell you, is it a usual thing? Tell him, well, okay, I'm really sorry for what happened. I'm really sorry for what happened. It shouldn't have happened from the start. It is a mistake. It is a mistake from our side. Please accept our apology. You've done it in the context. I mean, you know, you didn't emphasize, you didn't highlight this.
Okay.
Got me, Dr. May?
Yeah.
All right.
Yeah.
So yes, you told me no, it's not a usual thing. It's just once. I'm really sorry. So this is what you said. Okay. But it's better to tell him, well, okay, Mr. X, I know how you are frustrated right now. It is a mistake and it is from our side. I have to admit that. Please accept our apology about this.
Okay.
So you have to show that you are admitting that this is a mistake and you are telling him a very big, effective sorry. That's why I'm telling big, effective sorry. You have to show this in your way in dealing with the patient. Okay? If you just did it in the context, this will not be effective. Got me,
Okay.
Dr. May?
Okay.
All right. The start was very good. I always feel, Dr. Maya, you are starting in a very good manner, okay? And once we are go deep in the case, you just have, you know, a blocked mind. I don't know why. All right. So you started in a very good way. You asked me about my ideas. There's something went wrong in the treatment of your son and gave me a pause. Okay. And then you told me we reviewed the X-ray, and unfortunately the consultant picked up that there is a presence of a piece of glass. Okay, but after that, I felt that you were just, you know.
I mean, I just like, I mean, I just went with how you are reacting. So like, I didn't want to like I didn't want to like unnecessarily panic. I mean, I understand it's a big shock and it's scary.
Yeah.
But if like I saw you like not like, how could I say, like not so angry, not
Yes, I'm not angry. I'm not angry, but I told you, is it a usual thing?
I told you no, no. It's not supposed to, and it's not supposed to happen. But it happened.
Okay, so you tell me that. Tell me.
But
Say,
it happened.
say sorry, say big sorry. Even if I'm not angry, you don't say sorry once I'm angry. No, it's not because you say sorry not because I'm angry. You say sorry because this is a mistake. Okay?
Yeah, I understand.
All right? So even if I'm not angry, even I'm accepting what happened, and I'm telling you, is it a usual thing in the hospital? You tell me, well, okay. If you want to say no, okay, we'll tell it, well, no, it's not a usual thing. I know how you are frustrated right now because this is a big mistake from our side.
I
Okay?
know it's a big shock. I get it. I get it. It is
Okay.
very shocking.
All right. So just, you know, deal with the basics. Try to use the structure as it is. Okay. And that's it. All right. Even if I'm not angry, this doesn't mean that you don't say sorry effectively. Okay.
Okay. Yeah.
All right. Yeah. You didn't tell me about the short and long-term consequences because of the time. You tell him once this happened, you can tell him after saying the sorry. After saying the sorry, tell him, well, once this happened, we reported that, we escalated that to find out why did that happen and how to prevent this mistake from happening again. All right?
Okay.
Okay. All right, Dr. May. So, yeah. Thank you. Thank you, Dr. May.
Thank you, doctor. Thank you.
All right. Let's do the next one. Who is next?
Hello, doctor. Can I try?
Who's talking?
Hello. Yes, I'm Hala.
Hala. Okay.
Hala.
Hala. Yeah.
Yeah.
All right. No worries.
Okay.
Let's do the same case.
Okay.
Yeah. Happy to switch your camera
Yeah.
on or no?
If it's fine to do it without camera.
Yeah,
Okay.
it's fine.
Yeah.
It's fine.
I'm sorry. Yeah.
It's
Okay.
fine.
Thank you.
Yeah.
Yes.
All right. Okay. So
Yeah.
the same question. Adam, son Alex, 8 years, had an X-ray before. They didn't pick up that there is a piece of glass, and the consultant reviewed it and picked up that there is a piece of glass. Tell the father about the situation.
Okay. Okay.
Starting from now.
So, Adam, as you mentioned to me that you brought your son Alex to the hospital, and we did an X-ray for him, and we couldn't spot anything on his X-ray, and we sent you home.
Yes.
Yeah. So I just would like to mention to you that sorry, because there was an error happened.
Error happened. What do you mean by this error? What happened exactly?
Yes, doctor. Yes, Adam. So, after we send you home, the specialist reviewed again the Alex X-ray, and he reported that there was a piece of glass in his wrist and his joint. So I'm sorry to tell you that I missed that. I'm really sorry.
So do you mean that there's a piece of glass in his ankle and you missed it in the last time?
Yes, actually, Adam, yeah, we missed it, unfortunately, and I'm really sorry that I have missed it. Please accept my apology. It shouldn't be happen from my side. I'm really sorry about that.
I can't believe that. So, I don't know. So,
Yeah.
what will happen now?
Well, Adam, for now, I would like to you to, if you could bring Alex back to the hospital so we can manage his ankle now. We could refer him to the pediatric surgeon so to reassess him, and we could do some surgery for him to remove this piece of glass. Is that okay with you?
I don't know. How can I trust you again?
Yeah, Adam, I can see that this is very disappointing for you, but let me explain to you that we will do an incident form for what has happened, and we'll report it to the hospital authority to be investigated to know why that has happened and to find any solution to prevent this from happening again.
Okay.
Yes, Adam, and also we will do a meeting with our seniors and consultants.
Thanks.
So okay, thank you.
Okay. Thank you, Dr. Hala. So how do you feel?
Thank you. Yeah, I think a bit hesitation at the beginning, a bit anxious to be honest. Yeah, I managed it in the short term to remove the piece of glass,
Okay.
and in the long term to escalate the situation. And I did the big sorry, as you mentioned from the start.
Okay.
But
Good.
yeah,
All right. Well, I'm happy because I feel that did you do any medical error before?
well, yesterday I did my first one, actually, yesterday.
I mean, this is the first time or you did it before?
Oh, I did it yesterday with my partner for the first time, and today this is the next one.
The second one. Okay.
The second one.
All right.
Yeah.
I felt that you were trying to follow the structure.
Yeah.
And it was good, to be honest. Okay. If you follow, especially in breaking bad news and medical errors,
Mm.
if you have a structure in your mind, you do it. Either the patient is angry or not angry, showing many feelings or showing anything. If you just go with this structure, you will feel like, yes, I'm professional, I'm going, smoothly with calm without without having any hesitancy. All right. But if you just go with the flow, especially in breaking bad news and medical error, this will be risky. Okay.
Yes.
So, you asked me about, you narrate what happened, which was good. Okay. Then you told me that there is a mistake happened and you gave me a pause, which was really good. Did you do that before?
Yes, yesterday I did this. Yesterday. So
Yesterday.
that's why I
Yes.
remember. Yeah, yesterday I did the first medical error case. It
Okay.
was about MI. Yeah.
All right. So you told him there's a mistake happened and you give a pause,
Yeah.
right?
Yeah.
Good.
Yeah.
Okay. Then you narrate, you told me what happened exactly. Okay. But you told me it's in the wrist. And the mistake is from your side. Okay. I mean,
Yeah. Mm.
you is the one who did the mistake. And I didn't say that in the question.
Mm-hmm.
Okay. So always be minded of the situation, all right? To avoid
Mm.
just assuming things. Yeah.
Okay.
So you are not the one who did the mistake. Okay. And the mistake is not from your side as a doctor. Okay. It's from the hospital side. Yeah.
Okay.
Okay. You narrated and you tried to give me a big sorry. With practicing, with more practice, you will be able to give a big effective sorry. It was a big sorry, okay? It was not very effective, but yeah, it was doing the job, all right?
Okay.
And you told me about the treatment that you want to bring the son to treat him. I would love if you just link or follow the big sorry with the consequences right away to gain the trust of the patient.
Okay, without waiting for asking me.
Yeah.
Okay.
Okay. So once you tell him, I'm really sorry for what happened and it shouldn't have happened from the start. Once this happened, we report that in an incident form. We escalate that. The hospital takes that seriously. They will arrange meeting to find out why did that happen and how to prevent that from happening again. This will, gain the trust of the parent. All right?
Yeah. Yes.
Okay.
Okay.
So try to link or try to follow the big story with the consequences right away. Okay. Good, Dr. Hala. Good attempt.
Okay. Thank you so much.
Thank you. Dr. Whom else? I
can try them. Their exams sooner.
Who has the exam sooner? Dr. Hadir?
Yeah, Hadir.
Are you happy to switch your camera?
Yes, just check please.
Okay. Mr. Sam had a kidney biopsy, right? You called the lab to check on his kidney biopsy. The lab told you that the sample is never received. The hospital investigated a lot with no obvious result, with no obvious cause. Okay? So explain the situation to Sam.
Okay. Okay.
So you have 3 minutes.
Mhm.
Start.
Hello, I'm Dr. Eroğlu, one of the doctors in this department. Are
Hello.
you Mr. Sam?
Yes.
Hello, Mr. Sam. How can I? Okay. Hello, Mr. Sam. Okay.
I'm fine,
Uh,
thank you, doctor.
okay. Okay, Mr. Sam. I understand from my notes you had a kidney biopsy. Is that correct?
Yes, doctor, I had a kidney sample. Yeah.
Okay. Before I proceed, can I ask why you did this kidney biopsy? What have you told about this kidney biopsy?
Skip this part. Okay, just break or tell me the error. Okay.
Okay. Okay. Okay, Mr. Sam. Uh, your kidney biopsy, unfortunately, we had a big mistake. I'm so sorry to tell this mistake, but we had this missed your kidney biopsy.
You missed the sample. What do you mean by missed the sample? Where is my sample, doctor?
I'm so sorry, Mr. Sam. You know, for your kidney problem, we took a biopsy of your kidney.
Okay.
After that, we sent this kidney biopsy sample to the laboratory. But a couple days later, when I asked to the laboratory about your kidney biopsy result, they told me they didn't took your kidney biopsy. When we searched about your kidney biopsy, we couldn't find exactly where is your kidney biopsy. As we thought about your kidney biopsy displaced in our laboratory. I'm so sorry to tell you that.
Right. Oh my God. So where is it? Where is it, doctor?
Okay, Mr. Sam, it's understandable you feel very shocked in this position. Anybody in your position can feel the same as you. We are really sorry about this incident. We will report this. Our hospitals our hospitals these at like these conditions, our hospitals take these incidents very seriously. We will report an incident. This is an incident, and after that, if you want, we have a service. You can make a formal complaint about this as well. This formal complaint service is behalf of on you, and they will help you as well. I'm very sorry on behalf of my team.
So what will happen now?
After that, you know you have a kidney problem. You have a kidney glomerulonephritis. Because of your treatment, we don't want any delay about your treatment. Therefore, I recommend you again taking the kidney biopsy. Is it possible, Mr. Sam?
No, I'm not going to take the kidney biopsy again.
I understand you are feeling.
Time's up. All right. Okay. Thank you, Dr. Yasmin.
So sorry, I'm hospital a little bit busy, and
It's fine.
therefore
How do you feel?
Yeah, actually, not bad, but sometimes I couldn't imagine the scenario on my mind. At that time, I'm a little bit confused. For example, in this scenario, I couldn't imagine the scenario. Where am I now? Is the patient hospital, or I am calling him, or does he know me, or I know him? Just I couldn't imagine the scenario. Therefore, the structure a little bit bad because of that, maybe.
Yeah. It's understandable. Okay. While you are talking, did you did you mention that you are, you are referring me to somewhere, or you are going to do the biopsy in another place or something like this? No, the situation doesn't, dealing with the medical error itself as a skill is not related to where you are exactly. Okay? All of the situation is telling you that the sample is missed, right? So you tell him, so the sample has been missed, or the sample is missed. And give a pause. All right? So in the medical error, they train you on how to narrate the situation in a simple way, in short sentences, to the point.
My sentences are long.
Not very long, but you were hesitant in telling me the situation. Okay? And this will affect your way in delivering the medical error. Okay? So if you are confident, you tell him, well, there is a mistake happened regarding your kidney sample. You didn't give me a pause. You went to the narration right away, okay? Then you tell me, well, I called the lab. Unfortunately, they told me that the sample has not been received. The hospital investigated a lot with no answer. So unfortunately, the sample is missed. Pause. Clearly to the point, right? Okay?
Okay.
I'm really sorry for this to happen, or I'm really sorry for that, for this, I'm really sorry for this to happen, okay? It shouldn't have happened from the start. Please accept our apology. Since this happened, we reported that, we escalated that, and they will arrange a meeting to find out why did that happen. Again, all right? They might do another meeting. They investigated, okay? So you tell him, we might do another meeting to find out why did that happen, okay? We will take that as a learning point, okay? By telling or doing maybe providing the hospital with a checklist, all right, to avoid missing the samples. All right? So always be confident while you are telling the medical error. Okay? Once you follow that, once you follow these steps, you will be able to be confident. Okay? All right, Dr. Yasmin? Good. A good try. Did you do any medical error before?
No, this was the first
Okay.
time.
Good. In front of people, so yeah, yeah. All right. So
I am just 1 month, I hope.
yeah, hopefully, yes. Hopefully you can manage. All right. Okay, let's do the next one, Dr. Whom? Dr. Isra, I think.
It's Dr. Hadis, I guess.
Yes, Dr. Hadir. All right.
Okay, hello.
Hello, Dr. Hadir.
How are you?
I'm fine, thank you. Happy to switch your camera on or no?
Okay.
Okay. All right. How are you? Good.
Yeah.
Okay. All right. So you are talking with the same patient. You called the lab to check on the kidney biopsy. The lab told you that the sample is never received. The hospital investigated with no results.
Okay. And what does he know as a diagnosis? We don't know.
You don't know for now. Okay, they suggest that he has glomerulonephritis, but they didn't diagnose it until now. All right?
Okay.
All right. Okay, so starting from now.
Hello, I'm Dr. Ghurab, one of the doctors here in the department. So, may I know your full name, please?
Yes, I'm Sam Zimmerman.
Okay, and what's your age?
I'm 30, doctor.
All right. So, Mr. Sam, I believe that you were here yesterday, because you were doing a sample from the kidneys. Is that correct?
Yes. Yes, doctor.
So, there is some updates I want to discuss with you regarding your sample. But at first, I need to ask you some questions for better understanding of the full situation, if you don't mind.
Okay. Move on. Don't ask me. Yeah.
Okay.
Move on.
All right. So, Mr. Sam, I fear that the news regarding your biopsy sample is not very good, as I believe that you had made this sample and we have sent it to the lab, and we were waiting for the result, but the lab has informed us that the sample was not received. The hospital has investigated and still searching for, and have started searching for it, but we didn't find it. So I'm really sorry to tell you that, Sam, but the sample is lost right now.
Okay. So where did it go?
At the moment, we don't know. As I told you, the hospital has started to search, but it came out without any result. We didn't find it. I know it's a big mistake from our side, and we did something wrong, and I appreciate how this may be upsetting to you, but we are really sorry for that.
So what should happen now?
All right, moving to what will happen. At first, I need to tell you that we need to take the sample again.
No, I'm not going to take any sample.
Okay, can you
Just
tell
give
me
me the
why?
treatment.
All right, but can you please tell me why you don't want to take the sample again?
No, it's a very stressful situation. I did do this sample before with a lot of pain. I'm not going to go through this pain again.
I totally understand that, and I know how this is unhappy event for you. But let me explain to you why it is important to do the test. The GB has suspected that you may have something with the kidney called glomerulonephritis, which means that there is inflammation of the kidney walls. And this type of glomerulonephritis has different types, and each type has different treatment. So we need to confirm the diagnosis with the only definitive method, which is the biopsy of the tissue of the kidney. So are we in the same page, Sam?
I can't trust you anymore.
I can see how you are feeling upset. I'm really sorry you feel that way, but we will do our best this time. I need you to know that the hospital takes this incident seriously. We do incident forms to investigate what happened and check what might be the cause and avoid it in the future. So how do you feel about that?
So how are you going to avoid that in the future?
I didn't hear you.
How are you going to avoid that in the future? How I make
Okay,
sure that this not happening, this will not happen again?
Okay, let me explain to you. The hospital will investigate in what happened, and as I told you, check what might be the cause. Then they will be discussing this in their morning meetings, and the lesson will be learned. I need you to know that they will learn. We will learn from the lesson, and I can see how you are upset and sad about that. So if you feel that you want to raise a formal complaint, I might guide you to the department which is responsible for this part, which is the patient advisory and the liaison service. They may help you to do a formal complaint if you would like. So are we in the same?
All right. Thank you, Dr. Hadir. The time is up for 2 minutes
Okay.
now. Okay. So how do you feel?
I don't know.
All right. Okay. So, you try to find out his ideas about the situation by asking him some question. I told you to move on. All right. Then you told me that there is a mistake happened regarding the results, and you didn't give me a pause. I highly advise all of you doctors to give a pause, give the medical error in two chunks, and between, after each chunk, a pause, please. This will help you to be confident. This will help you to be confident in delivering the medical error. Unfortunately, there is a mistake happened, and pause. You didn't give me a pause, Dr. Hadir. You moved on to the next part, which is narration. You narrated everything, and then you gave me a pause after that. All right?
All right.
Break it in two chunks, please. Break it in two chunks. This will allow you to be confident in explaining the medical error. All right? Unfortunately, there is a mistake happened during taking the sample. All right? And give a pause. All right? Then you narrate. You tell him, I've called the lab. They didn't find. They told me it's not received. So, and the hospital investigated with no results. Your sample has been lost or missed, and give another pause. So we missed that one.
Okay.
Okay? You talked a lot. And then give me a pause. So no, give it in a chunk, in two chunks. Yeah? You give me a big sorry. I would love if you follow the big sorry with this. It's always better to follow the big sorry with gaining the trust of the patient. Okay? All right? So the short term should be reporting escalation and the treatment, the next step in the management, which is taking another biopsy. Okay? And the long term, by finding out a solution to prevent that from happening again. When I told you, so what are you going to do to prevent that from happening again? What was your answer?
Investigation and morning meetings.
So
And
is this an answer for me, for my concern? Will this make sure that my sample will not be lost again?
so what is the answer?
All right. You tell him, okay. In the next time, we will make sure that your sample has been labeled and there's a checklist to be fulfilled before going to the lab. And we will trace it once it's received, you know, in a short time after sending it to the lab to make sure that the lab has received it. Okay?
Okay.
Got me? So
Right.
is this the answer or just telling him we will make it, we will do another meeting? Which one is better answer?
Okay.
All right. So the patient is concerned about what will happen to the next sample. If I give you another sample, how to make sure that this will not happen again to my sample. Okay?
All right.
The meeting is not the solution. The solution that they are going to discuss in the meeting is the solution to prevent that from happening. What could be the solution that they might put in the meeting? Arrange for a checklist to make sure that all of the points in the checklist has been fulfilled. We will make sure that we will be vigilant with your sample specifically. We will make sure that we tick all of the ticks while we are taking the sample, and then we send it to the lab and call the lab to make sure that it is received.
Okay.
Okay? Dr. Ali is asking, do I encourage complaint? Well, if you feel that the patient is still unhappy after all of this, offer him to make a complaint. Okay? But if he's still, if the patient is happy and he's understanding the situation and he's not unhappy, then you don't need to offer the pulse. All right? Okay? Let's do the last one. Who's ready? So you took a sample from Mr. White yesterday with other blood samples. Mr. White is going to have herniatomy. Okay. You called the lab today. They told you that the sample has been rejected because it was not labeled.
Oh, okay.
Okay. So you are the one who did the mistake.
Oh, okay. Sure.
Okay.
Yeah.
Explain to the patient the situation and tell him to come to take another sample.
Okay. Sure. So he's not in front of me.
Again?
Is it sort of phone or face to face?
Face to face.
Okay. Sure. Okay. So just his name, please.
Mr. Adam White.
Adam White. Okay. They took the sample because he used to have what?
So you've taken his blood sample yesterday with many other blood samples. Okay. You called the lab today to check on his blood sample. The lab told you that the sample has been rejected because it was not labeled. Okay? Got it? Dr. Isra?
Hello, can you hear me?
Yes.
Okay.
All right. So got it?
Yes.
All right. So you have 3 minutes.
Okay. So, hello.
Hello?
Hi, Mr. Adam. I'm Dr. Ali. I'm one of your treating doctors. I met you to take, and I've taken a sample from you, if you could remember me.
Yes, doctor.
So I'm really sorry to tell you that I've made a mistake regarding your blood sample.
What mistake, doctor?
So I'm really sorry. I've taken your sample yesterday, and I took other samples with it, so I forgot to put a label in your sample, and yeah, I'm sorry. So it's a mistake. It shouldn't have happened at all. It's from my side. I was supposed to put a label on it. So when I called the lab, they said that they rejected the blood sample because your name wasn't on it. I'm really sorry, Mr. Adam. Yeah, I know. Yeah. If I were in your shoes, I would have felt the same way. I can see that you were frustrated. So to make sure this never happens again, I'll make sure to document what happened exactly. Okay, and it will be discussed in a meeting with my team. Okay, and I will use the checklist next time I am dealing with any patient, especially you, to make sure that your sample goes directly to the lab next time. Okay. Oh, I'm really sorry. I know.
Okay, so what should happen now?
Okay, so I will make sure, as I told you, that your samples will never be missed, or other patients. So if you would please let me to take another sample this time, just to check what's going on with you.
Okay, if it's important, then yes.
Yeah, it's very important. Your health is the priority for me and my team. So we just need to take the sample again. And in the long terms, any patient, we will make sure, me and my colleagues, we follow the same protocol and the checklist, that this never happens again. So I'm really grateful that you are understandable and you don't mind me taking another one.
Okay, all right. Okay, doctor.
Thank you so much, Adam.
Thank you. Okay, all right. You still have time? Good. All right.
So we will go then to the medical part, taking the sample, but I don't know the background of the medical condition, so
Yeah, it's
yeah.
fine. Okay. All right. So, how do you feel?
Better than the Breaking Bad News one, I guess.
Okay.
Yeah, I'm a little bit disorganized. I talked about the short term and then long term, and then the short term again.
Yeah. Yeah.
Regarding your management and the other patients. So
Yeah. So, you told me that there is a mistake happened with a pause. You narrated and you told him that you were you had you are the one who did the mistake. You told me sorry. You were showing the regression. Okay. If I am a patient, I will tell you, okay, don't worry. All right, it's fine. It's fine. Okay. Which is good. Okay. Which is good.
I have a lot of body language. I do it a lot, so it's just cute.
All right. Yeah, and you told me big sorry. Yeah. After that, you tell me the consequences. You told me that you are once this happened, or once this happened, I reported it, and it will be escalated, and the consultant will discuss that in the meeting. Yes, and then when I told you what should happen after that,
Yeah.
you didn't tell me that. You told me, okay, we will make sure that this will not happen again. No, tell me, okay, I'm really sorry. We will need to take, if you don't mind, we will need to take another sample. You did that, okay, but
I should
after
bring the
telling
medical
me,
one and then
no, but you know, when I told you what should happen now, you told me, okay, we will make sure that the checklist is going to be taken. Tell me that I'm going to take the blood sample first, and then we will make sure that the checklist is ticked and everything is okay. And it is labeled because the mistake was the labeling, it's not been received. Okay? So always make sure what was the mistake exactly to link it to the short and long-term consequences. Okay? All right, but yes, it was good. It was a good attempt. All right? Okay. Good, Dr. Isra. All right. I'm feeling hypoglycemia a bit, doctors. All right. So, Dr. Marwa doesn't want Dr. May.
I can go,
Okay.
doctor, if it's okay.
Let's do it quickly, Dr. May. Yeah, start from now, okay?
Okay.
Yeah,
Hello.
start.
Okay. Hello.
Hello?
I'm May Ali, one of the junior doctors here. May I know your name, please?
Yes, I'm Sam Zimmerman, doctor.
Okay, and can I call you Sam?
Yes.
Okay. So how could I help you?
Okay, Dr. May, it's the same question.
Okay, so I'm sorry, like, could you like give me the question again? So
Okay.
I
The
was
sample, you took a sample from Mr. White yesterday with other blood samples. You called the lab today. They told you that the sample has been rejected because it was not labeled.
okay.
Okay. Explain to the patient the situation and tell him to come to take another sample.
Okay, all right.
It's a phone consultation, so yes.
Okay, all right.
Start.
Hello,
Hello?
am I talking to Sam Zimmerman?
Yes, doctor.
Hello, Sam. I'm May Ali, one of the junior doctors here. So, could you just confirm your age, please?
Blah, blah, blah.
Okay, all right, thank you for that. So, so Sam, I actually wanted to speak to you with regards to your blood sample. Okay?
Yes.
Okay, so, but just let me, to put things into context, may I know, like, why this blood sample was taken in the first place?
It was a problem in my kidney, doctor. They told me that there's a problem in the kidney and they want to take a sample to check what do I have exactly.
Really sorry to hear with regards to your experience and your kidney problem. So, Sam, actually, I'm afraid to tell you that something went wrong.
Went wrong. Okay, what happened exactly?
So, so what happened was that when I withdrew the blood sample from you,
Okay.
what happened was that when I sent it to the lab, they rejected the sample.
Okay. All right. So why it's rejected?
Okay, the reason was because I forgot to put your details on it. I'm so sorry for my mistake. Please accept my apology.
Okay. All right. So what should happen now?
So I will need you to come in as soon as possible. If you would like, I could arrange an appointment for you, or if you can come in today, that would be better as well. I will also report what happened. I'll report my mistake. Okay, and I'll fill an incident form. And I will just make sure this doesn't happen again. I'm really, really sorry. I'm so sorry, Sam.
And how are you going to make sure that this will not happen again for my sample?
Okay, so what will happen is that I will arrange a checklist, and I will just you know, like there's like a list for people who are supposed to be having their samples done. So like once I withdraw your sample, I will just have this list in front of me, and I will, you know, I will make a tick in front of your name next time, as a confirmation that I put the details on your blood sample. Is it clear so far, Sam?
Okay, but I can't come.
Okay, may I know why?
I did arrange before for this blood test to be done with my job, with my work, and I don't think that they are going to give me any other, leave to come again.
Well, I see. Okay. Would you like if I give you a footnote and I write down the reason is that that you're needing, you know, some tests with regards to your illness? Would you like that?
I don't think that this will work because also the hospital is far away from my home.
Okay, that one I can arrange it for you. You know, I will just check your address and I will look for the nearest health center where they can withdraw the blood sample from you. How about that? How does that sound?
Okay.
Okay, so are you happy that I arrange with your employer a fit note and arrange with the nearest health center
Okay.
for
All
the
right.
blood sample?
Time is up, Dr. May.
Okay.
Okay. How do you feel?
I think it was okay, a little bit better than the first medical error.
Yes, much better. Yes. It was much better. All right. So, you told me that there's something went wrong and paused, then you narrated. It's better to say that I didn't label the sample and the sample has been rejected by the lab. Instead of telling him, I called the sample and the sample has been rejected. Because he will ask you why it's been rejected. So it's better to tell the mistake from the start instead of hiding facts.
No. No, don't get me wrong. No, I didn't mean it that way.
It will be received like this, okay? So
No.
from the start, tell the mistake and don't, avoid the way that it might be received that it is hiding.
Misinterpreted, yeah.
Yeah, okay.
Okay.
All right. Big sorry, it was good. And then you told me, I would love if you tell me, I'm really sorry for what happened. Please accept my apology. Once this happened, I reported this and escalated this by myself. Okay? Before telling him to come. Got me?
Okay.
All right. Gain the trust of the patient and then tell him the next step. But yes, it was a better attempt, of course. Yeah. All right. Okay, doctors. Thank you so much and see you in the next session, inshallah. Yeah. Bye-bye.
Thank you, doctor. Bye.
Thank you. Yeah, bye.